What's up, my little toasters? We're about to play Ingrown Toenail Removal. This game is about what it looks like. So we got an ingrown toenail we have to get in here. But before you scrub in, this may contain graphic procedures inappropriate for children and squeamish to adults. Just so you know. You may like faint. Just like, oh, that toe.
Hello. And welcome to Surgery Squad's virtual ingrown toenail removal.
Well, thank you.
I'm Dr. Jeff, and I'll be guiding you through this procedure today.
Thanks, Dr. Jeff.
An ingrown toenail happens when the edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail.
Those toes is nasty.
An ingrown toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too loose. Improperly trimmed toenails, foot or toe deformities, injuries, and fungal issues can also be contributing factors.
Looks like there's a lot of that fungus going on right now.
There are some ways to treat an ingrown toenail at home to relieve some of the pain. But remember that you should never attempt to remove an ingrown toenail yourself.
Never get your scissors out.
If you're a diabetic and have an ingrown toenail, it is recommended that you go to the doctor immediately.
Diabetes.
Now that you understand the causes of an ingrown toenail, let's put on our gloves and remove one.
All right.
Our patient is ready, so let's begin by disinfecting the toe.
That sucker is just ready to blow up everywhere. Okay, click and drag that. We got to sterilize it. Oh, girl, I'm going to paint them toenails. I'm going to paint them. Here, let me just clean this toe up pretty good for you. But these toes up, that's a beautiful orange color. I like that. Beautiful. Get that pinky toe. Can't forget pinky. And then we draw a little smiley face on the foot. Happy smiley face. Okay, we did it.
Now, we need to numb the toe with a local anesthetic.
Okay.
We'll have to inject the anesthetic in several locations around the toe.
Fair enough. All right, it gives me some little spots that's stick it in there right. Ooh, it's bleeding a little bit right in that infection around the tip of the toe. Oh yeah. Okay, right here on the edge. Oh yeah. My smiley face is kind of going away.
Now we'll wait a few minutes for the toe to get numb.
5 minutes later. Go to get that toe.
Now that our patient's toe is numb, place the special tourniquet around the toe. This will help reduce the amount of blood coming from the wound. Once you've done that, we can move on to removing the ingrown portion of the toenail.
Toe, will you marry me? Yes, yes I will. It's the happiest moment of my life.
First, carefully slide one blade of the nail anvil under the affected nail.
I don't know if I want to. Okay, Addy, let's do it.
We're going to go down the nail until we feel a little bit of resistance.
Oh, no.
Our patient's going to feel some pressure as we cut away the ingrown nail.
All right. Oh, it's like having a splinter under your fingernail. Like, place a toothpick under your toenail and kick a wall kind of thing. Oh, yeah. Oh, yeah. Oh, just jab it up in there. Stab him in the toe. Oh.
Great. Take the forceps and carefully remove the ingrown nail.
Okay, I can do that. Forceps. Grab that nail and just... Oh, it's like... Oh, gross.
It's getting kind of messy in there. Let's clean up that blood.
Okay, yeah, let's dab up that blood. You're gonna bleed to death at your toe.
See that small bit of pale yellow substance right there? It looks like the patient has a bit of infection in the toe. Firmly squeeze the edge of the toe to get as much of that infection out as you can.
Okay. It's gonna be like a pimple. Let's just squeeze that. Oh! Oh no! That was gross.
That toe is starting to look much better, but we're not done yet.
Beautiful.
Next, we're going to apply some phenyl acid to the wound. This will help ensure that the problem of ingrowth will not reoccur in this toe.
Okay, so I mean, this toe looks much better. It's missing half its nail. It's a big open wound. Let's just, what is this? Let's just apply whatever this is in there.
When you're done inserting the acid, I'll remove the tourniquet and we'll finish up.
Oh, no, stop. This poor toe. And then blood just shoots out.
Finish by applying some antibiotic ointment on a sterile gauze pad.
Dr. Jeff's, don't worry. Just put that all on there and...
Place it against the toe and wrap it in a gauze bandage.
Okay. Wrapping it up.
Fantastic job.
Thanks.
Since there was some obvious infection, our patient will be sent home with a prescription for some antibiotics. We'll also need to tell our patient to keep the wound dry, clean the wound regularly, and replace the bandage 2 to 3 times a day. While our patient's toenail isn't likely to regrow, his condition is likely to return if he doesn't take care of his feet. This includes wearing proper fitting shoes, properly trimming his toenails, and keeping his feet clean and dry. And that's how we remove an ingrown toenail. You did a great job today. While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
Oh, wow, there's all kinds of things. So I guess if you get an ingrown toenail, they cut half your nail off, the rest of the toe just kind of grows over. It's like you just cut your whole nail off and have like a big alien-looking toe. Crazy. We're gonna try some of these other surgeries in other videos, but that was kind of gross. That was a little. Ugh. Anyway, I hope you enjoyed this video. We'll see you guys next time. If today's your birthday, happy birthday. For realsies. If it's not your birthday, have a merry, very merry unbirthday. Stay toasty, my friends. Hello.
Selection.